I was also interested in the fact of you were saying too that if you were moved to get up in the middle of the night to go to someone who may have been on their deathbed, that you would may have to ask permission to go. How receptive is speaking openly about your faith in the medical profession?
Depends on who you're dealing with. But I told you about Dr. Larimore, and the medical profession has pretty well rallied around the notion that there are three acceptable ways to talk about faith to a patient in the medical setting. One is to ask permission.
Okay.
The second one is to ask for their faith story.
Okay.
And the third one is to pray with them with their permission. So faith flags, Dr. Larimore likes to talk about faith flags, faith story, and prayer.
Okay.
And you can't preach the gospel. You can't sit down on the bedside and say, now let me talk to you about this, and talk to them about the gospel in the same way you talk to them about penicillin. Because by coming into the hospital, they've accepted a certain authority that you have based on medical textbooks. And that's already assumed. So you can't assume that the patient is accepting the relationship based on spiritual principles until you ask them if they will. And then they have three choices then. They can say, well, yes, doctor, I'd love to talk about that, but I'd really prefer to talk to a chaplain. Can you hook me up with a chaplain? Or they can say, I'd love to have you talk about that. Thank you for asking. No doctor has ever asked this before. Tears in the eye. I really feel wonderful. Or they say, thanks for asking, but no thanks. I know I believe what I believe, and I just really, I'll pass. Thank you very much. And the third option is the least common of the three.
Okay, the prayer with permission.
The denying permission. You ask permission to talk to them about spiritual things, and they say, no thanks, doc. That's less common. Because if it gets to complex questions in the hospital room about God and the Bible, that's the chaplain's prerogative anyway. I mean, you're going to talk to them about God, you're going to give your testimony, you're going to raise the issues. But if they have significantly complex issues, that's the chaplain's business. And the clinical healthcare professional should work with the chaplain and should have a chaplain they trust that's coming from biblical standpoint. And they even have chaplains now in outpatient settings. It's not just inpatient anymore.
Oh, cool. That's just in your state, or you think that's something that's
around various places?
Okay.